with. I'm going to remind you, so what we looked at already, looked at the frontal, parietal, and occipital bone. Okay, so those are two parietal bones. That's an occipital bone, and we don't see the frontal bone in that picture. So the next one to talk about would be temporal bone on the side. You can see temporal bone here, the brown one, and on the model you can see it here on the side. Four regions. The squamous part right up here, okay, you can see it. Zygomatic part, zygomatic process actually here, okay. Mastoid region right here where the mastoid process is. The mastoid process. I actually can show it on Patrick as well. It's a mastoid process. The tympanic region around the acoustic meatus, okay, and the petrous part in the back of the temporal bone. The petrous. Okay, so squamous, tympanic, petrous, and mastoid. Now, this picture shows you the three cranial fossae, the anterior, the middle, and the posterior cranial fossa. You can see it here as well. The anterior, the middle, and the posterior cranial fossa that we just discussed during the last class. And I showed you how brain model right there can be easily fit into this fossae. That's actually how configuration of the brain repeats the configuration of the inferior surface. Sorry, configuration of the skull repeats the configuration of the inferior surface of the brain. And here you can see the bones. You can see the yellow frontal bone. You can see the orange temporal. You can see brown occipital. You can see a piece of the parietal bone here that is kind of purplish. And we didn't talk about these bones yet, but that's our next stop. Yes?
Just real quick, is every last one of these up for question on the test?
The bones.
Like, no, like every last, like all of these.
All of these what?
Arraignment, you know, like all the
Oh, no, don't worry. You're going to have the full list of the anatomical terms that you may see on the exam. And it's what I call a closed list. Doesn't mean that you can read it, but it means I cannot deliberately add something to it. So if I accidentally ask you something that's not in the list, the question is voided. Does that make sense? Okay, does that make sense? Okay, so that's how it works. It's going to be both for bones and muscles. You're going to have a list of things that you have to know. Okay? Sphenoid bone. I suggest when during the break you come and just check it out. I think it's a prettiest bone in the body. It looks like, well, they say it looks like a bat, or like, I'd rather say it looks like butterfly. It's more romantic, okay? It looks like butterfly. And it's so-called keystone bone. It articulates with all other cranial bones. It means it forms pretty much joints. So there are three pairs of processes, the pterygoid processes here. You can see them, these two things, and you can see them on the picture, okay? And greater and lesser wings. You can see the greater and the lesser wings here. Sphenoid bone actually houses one of the sets of sinuses, sphenoid sinus. We talked a little, I mentioned it, that you have frontal sinuses, maxillary sinuses. Well, sphenoid bone also has sinuses. It has empty spaces inside of it. Ethmoid bone, which the problem with the sphenoid, it's not a problem, but on the skull model, you can kind of sort of see the sphenoid bone here as a component of the skull, and the part of ethmoid bone here, the cribiform plate of ethmoid bone, if you look inside. So ethmoid bone is located deep in the skull, and it forms a part of the nasal cavity, actually a roof of the nasal cavity. Perpendicular plate of the ethmoid bone, where did I put it? Okay. The perpendicular plate of the ethmoid bone forms the nasal septum. The word septum means what? Anyone? Separation, yes. So nasal septum is the structure that separates your nose into the left and right nostril. And it consists actually of two bones and one cartilage. So the superior portion of the septum is the perpendicular plate of the ethmoid bone, and we're going to talk about others. If you again take a glance in here, in the skull, you will see that structure that is called a cribiform plate. You're gonna notice that it has multiple like little holes. Anyone remembers what those holes are? What comes through those holes? I'm gonna give you a hint. It's a roof of nasal cavity, huh? Exactly, olfactory neurons. Bunches of olfactory neurons come through the cribiform plate, okay? And when you look at the skull right here, that's where the olfactory bulbs are, where the olfactory nerves start, okay? Now look, this kind of shows you the location of the bones. So you can see those big bones, frontal, parietal, temporal, occipital, okay, can be easily seen. A part of sphenoid can be seen as well, right here, okay? But when you open up the skull, it's much easier to see the sphenoid bone with the sinuses, okay? And you can see sphenoid bone when you look at the skull from the bottom, kind of, sort of, it's really, on mine it's not very noticeable. But when you open the dome of the skull, you can see the sphenoid bone forming most of the medial cranial fossa. Okay? Sutural bones. Take a glance at the sutures, the joints between the bones. What you'll see there, well, I can see on mine, right here. Look at yours. You may see the same. The little sesamoid bones, irregularly shaped sesamoid bones that appear in sutures. Okay, they're pretty common in a skull. They don't play any, specific functional role, and in fact, the number and location of sesamoid bones, of sutural bones, will be different in different individuals. That make sense? So, facial bones, there are 14 of them, and again, you may react, oh God, 14, how am I supposed to know them? Most of them are paired, and others are very simple to memorize. The first, the mandible, the lower jaw. Okay? Dude. Yeah, this guy has a problem with TMJ. So mandible. It's not paired, but maxillary bones, the upper jaw, left and right. Zygomatic bones, left and right. Nasal bones, that's what's being broken, you know. When people get hit in the nose, nasal bones right here, left and right. Lacrimal bones. If you would take a glance here, they're very small bones on the medial surface of the orbit. Okay, they have the lacrimal fossa here. The lacrimal bones. Palatine bones form a part of the palate right here. Okay, palatine bones, the posterior part of the hard palate. Those are paired. Vomer is a thin bone which you can see if you look down the nose. It's inferior bone that forms part of the nasal septum right here. And two inferior nasal conchae. Without disassembling the skull in pieces, it's really hard to see them. Well, actually, if you look down the nose, there are like folds on the sides of the nasal cavity. You see these folds? So the lower one, the inferior one, is the inferior nasal conchae. Okay? We're going to take a glance at those bones, you know, each of them separately, and we'll start with the largest bone of the face, the mandible. It forms the only freely movable joint in the head. Temporomandibular joint, the TMJ. That's the joint that clicks when you chew something. Most of the people have clicking TMJ because of slight dislocation of the mandible, improper position sometimes. It comes from the teeth position, you know. It's fairly normal, okay, to have clicking sounds. You can notice several foramen here. On the, should I call it interior portion, the mandibular foramen and the mental foramen. Those are the passages for the nerves. Okay, the temporomandibular joint is formed by the condylar process. You can see the condylar process here. And coronoid process here doesn't form a joint, it just articulates with the zygomatic bone. Maxillary bone, the upper jaw. Okay, they develop as two independent bones and then fuse in the middle. So this is technically a joint, but it is ossified. Okay, so this is a keystone bone, articulates with all other facial bones except, surprise, mandible. You may ask, wait a minute, how about this? Well, this is not articulation, because technically this is not, you know, your upper teeth and your lower teeth don't form a joint. It's not a joint, it's your freaking mouth, okay? It's not a joint. Alveolar processes, right here, you can see, each alveolar process, they hold the teeth inside. Actually, the same alveolar processes can be found on the mandible. Okay. Inside of the maxilla, you're going to find maxillary sinuses. When you have runny nose, a really congested nose, pressure on these points causes pretty severe pain because your sinuses the pressure in them becomes lower. The air in the sinuses it is being absorbed. Sinuses are blocked. No new air comes in. Pressure is lower inside. When there is a mechanical pressure on the outside, it causes the pain. This is how you can diagnose actually sinusitis, inflammation of the sinuses. They are maxillary or frontal sinuses. So this picture shows you the position of the mandible. I don't think it is of any concern for you to recognize this bone. Okay? But the maxillary bone here is in, what is the violet color? Whatever you want to call it. Okay? You can see the violet maxillary bone, which forms actually an anterior 2/3 of the heart pallati. And I want to highlight that actually the maxillary bone forms a good bit of the orbit here. Okay? Orbit is formed by 5 different bones actually. Zygomatic bone. You can see it highlighted blue on this picture. It articulates with the frontal bone, the maxillary bone, and the temporal bone. So there's several processes. I don't have the zygomatic bone per se here. It forms an inferior and lateral part of the orbit. You can see that. Okay? And this is what determines how prominent the cheeks are of a person. Yep. Yep. Exactly. Something like that. Nasal bones and lacrimal bones are rather small. You can see the nasal bones here. See them? The blue ones. And the lacrimal are green. It's not that easy to locate them on the skull because they're not colored. But you can try. Well, nasal bones are fairly easy. Right here. That's what is getting broken. Okay? Lacrimal bones, if you would look on the sides of the nose, here and here, you will see the fossae, the little tiny depression. So that depression is called a lacrimal fossa. And lacrimal fossa is, no surprise, located on the lacrimal bone. Palatine bones and a vomer. You can see palatine bones being light green on the picture, and you can locate them if you would look the bottom, the heart pallati right here. You see it's kind of separated from the maxillary bone. Vomer finally is the plow-shaped bone. On this picture, it's highlighted in blue. So this picture, this one, okay, right here, it is a mid-sagittal section of the skull. Does that make sense? Skull being cut exactly at the middle. And you can see the perpendicular plate of the sphenoid bone right here, forming the superior portion of the nasal septum. Vomer, which is highlighted in blue, forming the inferior portion of the nasal septum. And cartilage, the nasal cartilage, which is very, very light violet here, okay, that forms the nose. It's pretty much one of the determinants how your nose looks like is the size of the nasal cartilage. And by the way, if you ever saw or heard about the disease named syphilis, I bet you heard about the disease. Have you seen people with a 3rd stage syphilis? Well, of course you didn't, because we treat it, so you didn't see people. But if you would look the pictures. I should have said pictures of the people. One of the very common problems, but not the biggest problem of those folks, they don't have a nose. Pretty much they don't have a nose here. They have a hole, but not the nose, not this part. Okay? Why? The bacteria slowly destroys the connective tissue, including the cartilage. So cartilage is gone. So pretty much they have this opening in the center of the face. Really, really disturbing. Let's put it this way. Yes?
I'm assuming that probably complicates things a lot.
Huh?
It probably complicates things, health-wise.
Trust me, it's not the worst thing. It's probably the minor of their concerns, because at the same time patients usually experience the neurosyphilis, the brain infection, spinal cord infection. So not having a nose is just icing on the cake. Inferior nasal conchae, they labeled green on the picture. I won't be able to show them to you clearly on the skull. You can look into the nasal cavity and identify them yourselves on the sides, the folds on the sides of the nasal cavity. And here you can see them labeled green, okay? Inferior nasal conchae. Right? Actually, if you would look down the nasal cavity, you're going to see not one but two folds. The third one, we have three nasal conchae: the inferior, the middle, and superior. And those folds, what do you need folds for? Increase surface area. Why do you want to increase surface area in the nose? You have epithelium only in the roof. What happens to the air in your nose? Huh? It gets cleaned by what? Not so much mucus and hair, just hair. Something else happens to it. Your mom always, yes, it's heated up and moistened, okay? So to increase the heat exchange, you increase surface area. Does that make sense? Increase heat exchange and water exchange, sort of, humidification. Is that right? Yeah, sounds right. Okay? It increases the and also the longer time air stays in your nose, the better you're going to smell, not because of the conchae, because the air becomes turbulent, and the exchange is going to be more effective. So this conchae, they actually kind of slow down the air as it gets through your nose down in the respiratory tract. That makes sense? So when you see folds, always think surface area. Orbits, where your eyes are. You can see the orbit right here, and it's actually good because I can show you the orbital fissures in the optic canal, and you can look them up at the skull. So this is the inferior orbital fissure, this is the superior orbital fissure, and this is optic canal. Okay? Optic canal is actually the opening through which optical nerve leaves the eye. You see how many bones form it. If you look at it, frontal, sphenoid, the purple one, zygomatic, the blue one, maxillary, the violet one, and it's right in there. Palatine, which we can't obviously see from that side, the lacrimal bone. And the ethmoid, which we kind of sort of can see here. So many bones, 7 bones form the orbit. Nasal cavity, as we already discovered, is formed by the ethmoid bone, the palatine bone, which forms the floor of the cavity, okay, maxillary bone, also a floor of the cavity, vomer, and inferior nasal conchae. Okay. And finally, sinuses can be found in the cranium. So we've got frontal, maxillary, and two that I cannot actually show because I would have to split my head in half. The sphenoidal and ethmoid. So you have ethmoid, I have sphenoid sinuses. Often when you have a nasal congestion, you have a headache, right? And this headache is usually localized to this area. It can actually spread outwards, but it often starts from here, where frontal sinuses are, because pressuring them is lowered and just air pressures on them. Okay. There's no good treatment actually. Sometimes the infection of the sinuses is called sinusitis. It's extremely unpleasant, but good.
I've never had that happen to me, and I've seen people like put like their hand on their face because of the pain, but I've never
Yeah.
experienced it. I remember one time I had like a headache and legit like one spot. Like when I say you could take a pin and put it to where that spot was, it was like in one small spot. Was that like a sinus?
It's probably not. It is more diffuse pain. So it's usually bilateral. So in the both sinuses usually get infected at once, and it's more diffuse. It's not one spot. Okay. But it may not have ever happened to you. It's not that it happens to everybody. Maybe you have less sensitivity. You don't get such horrible nasal congestion. The problem with sinusitis is that it can become chronic. In this case, the surgeon is to go in with a special tool, pretty much drill the hole in the sinus, suck out the pus from the sinus, treat it with antibiotic and give you antibiotic, and that really helps. But it's one of my colleagues who actually underwent this surgery described it the next day. He felt like he was punched in the face, and I believe multiple times. So I mean, you walk around normally, you don't have any other symptoms except for the sensation. You look normal, but it hurts like you were punched in the face. Hyoid bone. Right? Yes. Yes.
When someone has a migraine, or like has really bad migraines, I've heard of like treatments where they're injecting, is it Botox like or something, or inject like injections in their head. I had a friend and he gets really bad migraine.
Okay.
And some sort of injection. I don't want to say Botox, but it is Botox. Yeah, it might be Botox.
Oh, let's see.
They give them Botox injections.
For the migraine. Okay. How Botox injection works for migraine? That's a great question, actually. Botox is, what is Botox? Anyone knows? Huh? It's a poison. Great, it's a poison. It's a toxin produced by a bacterium called Bacillus, no, Clostridia botulinum. It is Bacillus, Clostridia botulinum. What happens to it? Okay, it is this bacteria often found in improperly prepared, like home preserves and stuff. If you didn't clean them up properly, it can accumulate there, and bacteria actually can die, but toxin will remain, and if you eat it, you get poisoning, and it's really bad. Because what happens, it inhibits the ACH, acetylcholine receptors, preventing the acetylcholine signaling. Okay? So when Botox is injected as a part of a plastic surgery, it causes muscle paralysis. Okay? Muscles relax and wrinkles like straighten up, and everything works fine. Although if you would look at people who kind of overdid Botox, it looks like they have a mask because they essentially cannot move the facial muscles, right? Because they are all paralyzed. I mean, when you paralyze it here and there for just a little bit, it's fine. But when like the whole face is paralyzed, that's what you're gonna see in people who kind of abuse it. In case of migraine, my best guess would be that they identify a nerve that causes migraine and block the signal transmission. That would be my best guess for this. Okay. Now the hyoid bone is interesting because first of all, it's not considered a skull bone, and second, it like hangs in there. Okay. It doesn't. So if you would look at Pat, it looks like it articulates with the vertebra, but it doesn't. There's just a couple of wires that attach it because we can't actually levitate the bone. Okay, it has to be attached to something. Yes. I don't really. Well, it's not a part of the jaw. Its function is completely different. It provides support for the muscles that move the tongue. Speech. Okay? Speech, swallowing, all tongue-related activities are linked to the hyoid bone. But it is not articulating with any other bone. It's kind of hanging in there. Okay? The column, the vertebral column, we're going to pay a lot of attention and kind of giving you a heads up what you have to be able to tell apart. A few things. First, different segments of the column. And you have to be able to tell apart cervical, thoracic, and lumbar vertebrae. Unfortunately, I can't find the vertebrae here. You should have them in one of the drawers. Check them out. They may be like on the chain now. Look it up. Do you have them? No? Okay, yeah, you got one. Well, it's definitely not enough. No? Nothing? Okay, I'm gonna bring out during the break. I'm gonna bring out the like a chain of vertebrae hanging separately, and you will get a chance to look at them. But so far, let's first talk about the function of vertebral column. So it maintains the trunk. Okay, actually transmits the weight of the trunk to the legs. Okay. Protects the spinal cord, of course, and it's curved. So it has cervical curvature right here with 7 cervical vertebrae. Yeah, go ahead, be my guest. 7 cervical vertebrae. Then you have thoracic curvature, okay, with 12 thoracic vertebrae. Then you have lumbar curvature with 5 lumbar vertebrae, and then sacral curvature with fused sacral vertebrae. If you would look at the sacrum, can you see sacrum, Patrick's sacrum from here? Okay, it's one bone, but this bone is formed by several vertebrae that are attached to each other. They fused in one bone, and then there's a coccyx. This one. Yes.
Are the sacral ones like not connected when you're like a child, or are they connected by the time you're born?
They are connected by the time you're born, but I believe the articulations between them may not be ossified completely yet. Okay? Yes?
Do they name it like, you know how L1, L2, like is there S1, S2, or is it just one?
Technically, yes. Every couple of sacral foramina. You can see sacral foramina, the openings in the sacrum. Can everybody see that? Let me see if I should have. Yeah, so here's the sacrum. See the openings? Every pair of openings corresponds to, this is going to be corresponding to S1, S2, S3, S4. Does that make sense? But you can't really see the separate vertebrae here. And there's a coccyx, the vestigial bone. It's the remnant of something. Yep, the tail. In some people, actually, sometimes they do have tail. And actually, yeah, the vestigial structure in some folks, tail may grow. They have to surgically remove it. It's not like, you know, like this long that allows you to climb trees. It's usually fairly short, maybe 2-3 inches. Okay. Hmm?
I don't see about the 5 different things on the sacrum.
They not, okay, you sure you're not mixing up the lumbar and the sacral? Okay, so sacrum, you see the foramina? So this is what used to be a vertebrae, sacral vertebrae. This is second, this is third, this is fourth. In your case, maybe 5, you know? But they not separate. You can't say this is the boundary. Although here I can say, okay, this is the first, this is second, this is third, this is fourth. Those are distinctive bones. Does that make sense? Awesome. Now, look at the curvatures. So this is concave. This is convex. Right? If we look at this direction. Does that make sense? Pretty much, the idea here is that it goes, look, this way, this way, this way, this way. Right? Cervical, thoracic, lumbar, sacral. Does that make sense? So far, only the sequence. So they go back and forth. So what is the important? What can you compare the curvatures to, function-wise? It's like a coil, right? Does that make sense? If that thing would be straight, every jump, you're like jumping on the straight legs. When you jump down from like a table, you always want to land on the slightly bent knees, okay, so you can reduce the impact on the knees. Same here, it reduces the impact on the vertebrae. Although the abnormal curvatures decrease the ability to buffer the mechanical stress, and they also may cause some other associated abnormalities. There are 3 major types of distorted curvatures: scoliosis to the side, like this or like this; kyphosis, we call it hunchback, usually develops in older people, although sometimes can be found in younger ones. And lordosis. It's a common condition in the pregnant women. That's just the way they compensate for increased mass on the front. So that's kind of, you know, what they develop when they have to carry a growing fetus. So lordosis, yes. Yes, they go back to normal. After they have the baby, they go back to normal. Now, what is the reason for actually both kyphosis, lordosis, mostly? What keeps your back straight? Yes. Huh? You can't really control it. Well, kyphosis partially, yes, because the intervertebral discs they lose water, they shrink, they become less flexible. But what keeps you, what muscles? Muscles, back muscles. By training back muscles, you keep your posture straight. This is it. As simple as that. So people with the properly trained muscles of the back are less likely to develop kyphosis in the older age. Okay? Does that make sense? Now, what is the problem with kyphosis? Think about this. Yeah. Uh-huh. It reduces the ability of your chest to expand. This is how we breathe, actually. So it reduces your breathing capacity. It's called lung compliance. Okay? It becomes harder to breathe, simply. So and it is associated with, I don't know, less endurance, less physical performance, so on and so forth. So it actually has some associated conditions with that. The individual vertebrae are connected by ligaments. Okay, you have longitudinal ligaments, the anterior and posterior, that run all the way from neck to sacrum. And by the way, how can you tell the front and the back part of the vertebrae? The back is this prominent process. If you will touch your vertebrae, you will feel them. You actually feel each one of them. You can count your vertebrae. Okay? So the front will be actually that body of the vertebrae. Ligamentum flavum is the short ligament that connects adjacent vertebrae. They're pretty short, okay? Now think about this. It's like a chain. This vertebral column is like a chain. You have many links that are connected to each other fairly tightly, and they also have discs that cushion and prevent them from crushing each other. So the disc here consists of two layers. Let's put it this way: the inner and the outer. So inner layer, which is called nucleus pulposus, sounds very Greek. Or should I say Latin? Now look at the words. Nucleus. Well, it's nucleus. It's a core, right? So it's a core of the disc, which is pulpus. A lot of collagen, a lot of water. So it's fairly, it's elastic. It can be compressed. So it allows for that buffering. Make sense? Annulus fibrosus, fibrous layer that surrounds it. Fibrocartilage and collagen. So it's essentially like any good buffer. It has rigid, resilient outside part and elastic and compressible inner part. Okay? Now, when disc becomes deformed, when disc becomes deformed and kind of squeezed out from its proper place to the side, don't have it here, and one of there's one right there that kind of shows it. It's called a herniated disc. It's the one closer to me. This one, yes. So on the side you can see the red thingy. Oh, thank you. Thanks, Anthony. So you can see the red hernia right here. Okay? When part of the disc protrudes from its proper place, it starts to press on the spinal nerve. And depends on what nerve it is. It can cause sciatica, it can cause femoral dysfunction, numbness, and yes.
Will it cause like muscle spasms?
It can cause muscle spasm, it can cause inability to control the muscle, it's going to cause a lot of pain, especially sometimes a lot of pain, and because when you move in sort of improper way, okay? And most frequently, herniated discs can be observed, in the lumbar area. Yes.
How hard are these discs to like deteriorate? Like, do you have to really do a number on it? Because like my mom had L5S1 fused because her disc was completely gone. She had
Yes.
nothing left.
Yes.
How hard is it to like get it to that point?
With age, it happens. Huh?
42.
Well, when we say with age it happens, we talk about average. Generally speaking, as we get older, those discs become less elastic. If she was carrying a lot of weight, or maybe she was using the improper position, or she might have had the osteoarthritis, which for some reason, it's the normal condition that we develop, all of us develop with age, earlier or later. So if this osteoarthritis started here, inflammation of the cartilage destroyed the disc, and they fused the L5 and sacrum, yes.
How would you fix a hernia disc? By surgery?
Surgery, yes. Surgically fixed. I don't know the exact details, don't know the material. I cannot tell you about this, but I definitely know it is a surgery. Okay. So it's usually, when people try to lift more than they can handle, sometimes, and they do lateral move especially, because the vertical load shouldn't cause a hernia. But if there is any shift in the vertebral positions, so it's kind of sliding move of vertebrae, that may cause hernia. And if these are two vertebrae, if one presses on another, usually nothing bad happens. But if it's a little bit of a shift this way, it may lead to the protrusion, to the formation of the hernia. Does that make sense? It actually shows you here a herniated disc on the MRI. Some people live with that. Okay, they don't go through surgery, they just live with herniated disc. If it's not a life-threatening condition, they sometimes just leave it at this. Now this is the typical vertebrae. I definitely need to pull out. I'm going to pull them out, and during the break I kind of guide you through this. So this is the typical vertebrae, which actually you can see several elements. Come on, dude. The body. And as you go from top to bottom, you can see the body of the vertebrae becomes bigger and bigger because it has to support more and more weight. That makes sense? The vertebral lamina and vertebral pedicle all form vertebral arch. So body and the vertebral arch form the opening, which is called vertebral foramen. This opening houses spinal cord. Yes, that's where the spinal cord is. It's fairly well protected. Okay? Now, another foramen that can be found in the vertebral column is intervertebral. To see it, you have to look at the column from the side. And if you look at, okay, yeah, it's easier to show in this model. You can see those yellow thingies here. What are those? Any ideas? Spinal nerves. So spinal nerves leave vertebral column through the vertebral foramina. When you put two vertebrae one on another, there is an opening between them. An opening between them. You see? There are openings here formed by adjacent vertebrae. Those are intervertebral foramina. Each vertebrae has several processes. The spinous, that's what you touch when you feel a vertebrae, the spinous process. Probably the most prominent, the most noticeable. The transverse processes. These are transverse processes. And four articulating processes. Bilateral superior and bilateral inferior. The problem with these guys is that you can see them only on the isolated vertebrae, which I don't have, which I'm going to pull out. But essentially, I don't know how well you can see that from your vantage point. But if I will take this vertebrae, oh, okay, see the vertebrae here. These two, the ones that I touch with my index and middle finger, are superior articulating processes. Can you see them? On this guy, these two, they really small here that I touch. They are inferior articulating processes. Does that make sense?
Makes sense, but personally, I'm not sure which is which.
This and, okay, for example, this one. Like I scrape it with my nail now. That's the inferior articulating process. And it forms a joint with this superior articulating process. Does that make sense? It's like the lower vertebrae extends the arms and the upper vertebrae hangs down the legs and they hold, you know. Now, three groups of vertebrae: cervical, thoracic, and lumbar. Have several features that allow you to distinguish them very easily. Cervical are the lightest. Okay? Most of them, but not all, have fairly So these lateral masses articulate with occipital condyles on the occipital bone of the skull. And if I would be able to, this guy has the steel rod coming through its skull, so it cannot say yes or no, but I can. So that movement, the yes movement, is when these occipital condyles go back and forth on the superior articulating facets of the lateral masses. The axis, so the first cervical vertebrae is called Atlas. Do you know who Atlas was in Greek mythology? Yeah, he was holding the sky, right? Yeah, sky? Sky, yeah. Huh? Yeah. He always pictured like carrying the globe. Yeah. So that's Atlas. It supports the skull. The second one is Axis. Because of that thing here that protrudes from the body, and it is called dens, a tooth. And essentially that dens, if we would look on the side, it would pretty much look like flat, and there will be peeps right here. Okay? So that dens it's awful. Let me see if, no, I can't separate them. I can't separate them to save my life. So that dens, you kind of sort of can see it here. Okay? That dense thing protrudes upwards and goes into that area of the C1. So essentially, dens is the missing body of the first vertebrae. Does that make sense? They kind of made the exchange probably years ago. The body of the first vertebrae became this prominence on the second. Now essentially what happens, you have an opening and you have an axis on the opening. So it can go like this. So C1 can do the circular movements, the rotational movements around the dens of C2. This is that. The movement for no. When C1 rotates around C2. So cervical, we talked about them, they're lightweight, they fairly horizontal, you can see them here, double-edged spinous processes, and the transverse foramina. Thoracic vertebrae have also some fairly distinguishing features. First of all, the body becomes bigger, and the vertebral foramen becomes circular instead of triangular, as it was observed in cervical. Okay? Spinous process is not bifid anymore, and it's actually directed downward. See? It like points down. So it immediately allows you to distinguish the thoracic vertebrae from any other one. Also, thoracic vertebrae have very noticeable superior. We don't really have don't see inferior process, but superior and inferior articulate processes. Okay, just give me a second, okay? Those processes here and, well, not really seen here, are the ones that articulate these two different vertebrae. Now, the lumbar one is the biggest, okay? Big body. Again, triangular vertebral foramen. Very vertical transverse processes. But honestly, The easiest way to distinguish lumbar vertebrae? Look at it from the side. Does it remind you of any animal? A head. It's a moose head. It's a moose head. I'm going to bring out, during the break, I'm going to bring out the separate lumbar vertebrae. You will see, it's just, you look at it, it's a moose. Or elk, whatever. So, the big body, obviously, allows it to maintain all that weight. But interesting difference between the lumbar and thoracic vertebrae. A vertebral column in the thoracic region can rotate. Well, not in this guy, because it all like screwed to each other, but it can rotate. It allows you certain flexibility. When you go to the lumbar, those 5 vertebrae are locked to each other. Your lumbar part is very rigid, which makes a lot of sense because that's where the most compression is. And if you rotate in an improper way, it may screw up your intervertebral disc and can pose a bit of a problem. Does that make sense? Okay, let's take a pause, take a break, and when we'll come back, we'll continue talking about the bones.